So after you've identified somebody who has malnutrition or is at risk for it, there's certainly a role for nutritionists. And because most doctors I know can't do it, don't know how to do it, haven't been trained to do it. So is this a covered service for the elderly in general?
Unfortunately, Medicare right now only covers someone who has diabetes or kidney disease. And so a lot of times people slip through the cracks because unless they're able to pay for services because it's not covered by Medicare.
Yeah.
Which is unfortunate. I mean, I have insurance for many other companies and it's fabulous, but not for Medicare.
Not for me. And I think that's the Affordable Health Care Act sought to address some of that, but I don't think it really went far enough.
Yes. Yes.
I also think that one of our problems is that we don't have a good social network for people at home to follow up. I think we have to invest more in social services for people. A nutritionist going into the home, a physical therapist going into the home to check up on people who are elderly. And I've made a lot of house calls, which was one of the most eye-opening things that I did in my practice was to make house calls and saw how people lived, and it's shocking.
Yeah. Yeah.
It's shocking. I knew people who were millionaires who ate cereal twice a day for meals, and that's all they would eat.
Yes.
So it's an eye-opener.
It is. I did work for the Visiting Nurse Association many years ago where we would do some home visits, and it was very helpful to be in the house to see exactly what was in someone's cabinet and try to share with them what might be better options. But a lot of times it's just phone calls now that they're doing with nutritionists, so you don't really see what's going on. It's hard to communicate sometimes with some people over the phone, so it's not that effective.
Yeah. You know, there was a large study conducted recently that looked at dementia and attitudes towards dementia, and I believe that 40 or 60% of physicians believe that dementia was a natural part of aging. And first of all, how do you feel about that statement? Do you think that is a natural part of aging, or do you think we can affect diseases like dementia by altering our dietary habits?
I definitely believe it can be affected by altering, not 100%, but there's many studies now showing Mediterranean diets and things where you're reducing certain components of the diet, like inflammatory foods, like a lot of sugar or processed foods, and bringing in healthier foods, plant-based foods, a lot of healthy fats, and it's helping with dementia prevention.
Yeah.
Yes, absolutely.
There's evidence-based medicine to suggest that.
Yes, no question.
The doctor I spoke to also said that, you know, what we consider to be a normal aging process may not be the result of aging itself, but may be the result of our lifestyles.
Yes.
And so years ago, we lived to be 20s and 40 and 60, and now we're living into the 70s and 80s. But maybe if we knew enough about some of these issues and followed them, we could live into our hundreds.
Well, have you heard of the Blue Zone diet?
Yeah.
Yes.
Yep.
So he traveled all over the world to different pockets of populations that had the longest lives. And so what they discovered was that eating, certain eating patterns were more likely to help people live into their hundreds, 90s and hundreds. Well, we don't necessarily want to live longer if we're going to be sick and not feeling well, but really vibrant elderly populations. And that, the nutrition piece was absolutely one of them, more of a plant-based diet. Also exercise and social activity, it all kind of came together.
It does.
Yes.
Yeah, we say you don't want to put more years in your life, you want to put more life in your years.
Yes.
I think that's the saying.
Yes.